Regarding premenstrual syndrome, yes, 3 out of 4 women, it is said, experiences this once or twice or thrice in a lifetime. The thing is that premenstrual syndrome is actually, if you consider a very young age, a girl getting at a very young age, first of all, the fear of it might cause us some symptoms in her, because the premenstrual symptoms doesn't come in one, I mean, in a one symptom. There are plenty of symptoms or signs which might occur in a female. Secondly, when a girl is in, say, supposing it is in tension or some, psychological disturbances there, she might experience premenstrual symptom. This premenstrual symptom usually goes off as the girl grows up, gradually goes up and tries to know the problem. What happens exactly. Supposing she doesn't have any other abnormality in her, then this gradually grows up once she's married or she gives birth to a child. Now, premenstrual symptoms and signs, there are two things. Symptoms, there can be behavioral change, there can be depression, there can be fatigue, there can be abnormality and decreased appetite, there can be decreased sleep, whatever. But when we come to signs, yes, maximum girls, they get acne prior to menstruation. This is nothing. When a girl comes to us, we just usually try to explain that this falls under premenstrual syndrome. So, and this gradually it vanishes after she gets her periods, and once she grows gradually, when her age increases, the acne part usually vanishes off. Secondly, in case of we say diarrhea, maximum girls, they come with a history of giving us complaints of diarrhea. This is nothing because premenstrual symptom, one of the most common is the spasm cramps. So when the uterus contracts because of extra prostaglandin secreted, that I won't explain because you won't understand also. So because of that contraction, there's vasculature contraction also. This vasculature contraction decreases the blood circulation to the endometrial lining. There is release of those whatever the lining collects all throughout they die off and they get released. So this particular cramps can cause pain. Indirectly, because it is uterus is a smooth muscle, the smooth muscle is contracting. Same way, any smooth muscles in the body can contract. So the patient usually complains of pain in the inner thighs, lower abdomen. There can be diarrhea. So these are few signs also that we get in females. Then weight gain. Usually, you feel heavy before periods. So this is actually before menstruation. There's fluid retention in the body sometimes. This causes a bit of weight gain that again vanishes off. But premenstrual symptom, it happens usually after period and goes off. So nothing to panic about. We say the girls don't panic. This is very natural, and this with due time it gradually. Actually, we get habituated. It's going on, and then girls try to understand. They don't give much concentration on that. Initially, they might give, so that is not natural. Until and unless a patient has got some other abnormality which can cause her, pain. I'm not telling about premenstrual syndrome. Regarding the pain, there are few factors which can cause menstrual pain. Now, regarding menstrual hygiene, if I tell you, see, initially, even I saw people using in my career after becoming a doctor, ladies or girls using even cloth or tampons. We even got patients using tampons. But day by day, this have changed, and we have come to menstrual pads. So this is the first idea of a menstrual hygiene. Why shifting from a cloth to a pad? Because pad usually it is sterilized. Number one, changing of pads should be minimum 6 hourly. That is 4 times a day. If a patient have overflow, or a girl, I won't say patient, sorry. If a girl has overflow, then she can change even to 5 to 10. But changing of pads more than 7 is we consider as excessive menstrual flow. Then secondly is your cleaning. Like we usually don't advise using of soap or Dettol during periods. It should be only with clean water or whatever the vaginal wash are available in the market. This keeps a bit of more hygiene during menstruation. Thirdly is even the undergarments should be taken very care of, because few girls, they are shy of washing their panties during this menstruation, and what they do, they wash it and they don't go to the sun. They just try to dry it inside the bathroom or somewhere in the corners. So they should be properly sun-dried. The properly washed and properly sun-dried garments, they become sterilized, and it is very good to be used by the girls later. Fourthly, if you consider this hygiene part, at least a bath daily during periods. Sometimes, like girls, might be it's cold season when it's winters. Usually, they will not want to take a bath, but during periods, it's very good to take a bath daily. That keeps your mind also very cool. Your, physically also very good. And disposal of pads, here I'm just adding a bit. Disposal of pads should be very, very carefully done, because either the extra sheet can be torn off and it can be flushed, or if somebody disposes, it should be tightly closed in a good packet, and best is dumping inside the mud if it can be done. Because just throwing out the pads, what happens is a dog or a cow, they come across, they try to taste it once, they don't know what is it. And that way we are indirectly causing harm to animals. So nowadays we have come up with, to avoid all these factors, we have to come up with menstrual cups. And menstrual cups are very much available in market, and only thing is very easy to use. Only a bit of explanation is needed. Yeah, anybody comes to us to explain, we do explain. But it's very nicely, even on YouTube you get, everywhere you get how to use them. And it is very, but yeah, again this sterilization of the menstrual cups is very, very important. Some old people at home might think that how we are coming and suddenly putting our in the oven and boiling this one. But that also should be done in privately. Like it should be done giving full explanation to them why we are doing it. So I would always prefer nowadays where present girls should go with menstrual cups.